Well, good morning, everyone. My name is Andy Johnston, and I have the privilege of serving as Vice President of Government Affairs for your Grand Rapids Chamber. Thank you for making time to join us today for this town hall about COVID-19 vaccines. We've had many town halls during the pandemic to get information from leading experts and policymakers to our West Michigan business community, and so excited to be hosting a town hall with the word vaccines in the title. Two vaccines, I think, as we follow the news, one from Pfizer and one from Moderna, appear to be on the cusp of FDA approval, which of course is only the beginning of the massive effort to produce, store, and deliver doses to those that need it. Certainly tons of details to work through in this massive effort. Even with vaccines, the light at the tunnel is pretty far away for many. The next months are going to be difficult. Cases, deaths, positivity rates have plateaued recently, but at a high level. The governor, as I think we all know, declared 12 more days of pause yesterday, putting restaurants, theaters, and venues, businesses that have a big impact on our communities in an almost impossible position as workers miss paychecks and more businesses are thinking about closing permanently. Please think of these impacted businesses during this holiday season. Order takeout, buy gift cards, show your love for them on social media. Please use the hashtag support RGRBiz or participate in the Kent County Takeout Challenge. And I know Chantel will post those in the chat here for all of us to use. The Chamber continues to call on the governor's administration to give these industries some kind of opportunity to open safely in some capacity, and for the federal government to step up with some relief, which is what we need. The Chamber hosted U.S. Senator Debbie Stabenow yesterday for a meeting with members, and she remains optimistic about conversations on the bipartisan $908 billion coronavirus relief proposal, but time is getting short. Hopefully the sticking points can be resolved. We need action and leadership now from DC to support those in need. And we need action and leadership from all of us as we continue to work to get through these difficult weeks ahead safely and successfully. You can find out more about the Chamber's advocacy efforts at grandrapids.org. To help us understand what's coming next with the vaccines and what employers need to know, we're excited to be joined this morning by Dr. Adam London, the Administrative Health Officer for the Kent County Health Department, and Keith Hustak, Vice President of Advanced Practice Provider Services and Operations for Spectrum Health. Following my discussion with them, we're going to hear from Sarah Willey, attorney for Miller Johnson, on some important considerations employers need to be aware of as these vaccines become available. If you have questions for any of our guest speakers throughout the town hall, please use the chat feature. I'll do my best to get to them. I have a number of questions, but we'll always want to work in questions from our attendees. We're also recording today's conversation that we'll make available to all attendees after this. So with that, let's bring Dr. London and Keith to the virtual stage, and I will start with you, Dr. London. Where do we stand with the vaccines? You know, the Pfizer vaccine is being deployed in Britain. The FDA is voting on it Thursday. Moderna's close behind. What are your expectations about when we may see, vaccines being deployed in West Michigan, and how do you think the rollout will proceed?
Hey, good morning, Andy, and good morning, everyone. And it is so exciting for us to be talking about vaccine now. This has been a long, dark year for all of us. Feels like we've been on defense for a long time. To finally be talking about vaccine and the opportunity to go on offense and to win the game and get past this phase of this epidemic is really energizing for a lot of us. As you mentioned, the FDA is reviewing the Pfizer product this week. We hope that there's going to be an approval from that process at the end of this week. Pfizer has stated that they're going to be able to start rolling out shipments within even hours after that approval. What we have heard from the state of Michigan is that Michigan is expecting somewhere between 84,000 and a couple 100,000 doses within the week after that, which they are going to be distributing statewide. Now, we don't know exactly how many of those doses are going to be sent to Kent County or West Michigan, but we do know that in principle, the first recipients of that vaccine are going to be the hospitals, because they need to vaccinate their healthcare workers, the frontline workers and their staff, the health departments, who are going to be vaccinating their staff because they're going to be doing vaccinating as well. We're also going to be vaccinating the first responders, EMS, other critical emergency response staff. And we know that CVS and Walgreens are going to be receiving some because they're under contract to deliver vaccine to residents and care workers in long-term care homes and nursing homes, who are the most vulnerable of all people. So that's going to be the first push for vaccine. And with those healthcare workers and health department, it's kind of like the philosophy when you board an airplane and they tell you that if the cabin depressurizes, put your mask on before helping the child next to you. That's kind of where we're at with the philosophy behind the very first wave of this, is that we need our vaccine providers, our care workers, to be protected first, and then to start providing it for others. I expect this first phase of those most essential frontline workers to take a month, a couple of months, where then as supply becomes more readily available, we're going to be broadening who is eligible for that to include the other most critical essential infrastructure workers. We're talking now about teachers and school staff and childcare workers, people in the food supply chain, perhaps critical utility workers, and others that are in this most essential infrastructure group. And then from there, it'll become available to more of the general population. Optimistically, I think we're thinking March, April is when we'll start making that transition to availability for the general population. But a lot of this is going to rely on the question about vaccine supply. As you mentioned, right now we have Pfizer and Moderna, who are first out of the gate and first to receive review. AstraZeneca is going to be shortly thereafter. But there are over 100 products that are being produced around the world that are going to be reviewed in the coming months. Many of them are going to have, are going to be less high maintenance, if you will. These first couple products out of the gate require ultra cold refrigeration. They are required to be used pretty quickly once they've been thawed and brought to room temperature. And so they're difficult to create mass vaccine clinics with. As more products become available, many of these products can be handled in ways similar to our more standard vaccines. And many more providers in the community are equipped to do that sort of vaccine handling and delivery. So we're hoping to bring more products online, to have a bigger supply, and to have a more broad availability in springtime.
Thank you, Dr. London. Keith, with your role at Spectrum Health, you're working with the other health systems. You have a large footprint, right, across a big swath of greater West Michigan, talking to a number of provider organizations. What are you focused on in this effort, building off what our health director just said?
Yeah, thanks. I'm from Ohio. I've lived in other parts of the country and on the east side of the state. And I can just tell you, I think we all should be proud to be in West Michigan. We are really part of what's called the West Michigan COVID-19 Vaccine Collaborative. What that means is, we're coming together as Spectrum Health, as Metro Health, as Mercy, Kent County, Ottawa County. We have universities and schools. So Grand Valley, Michigan State, Calvin College, our independent provider organizations, Answer Health, we're removing our badges in our, the Block M or the Spectrum Health badge. And what we're doing is we're coming together for the betterment of our community. We certainly learned a lot during the H1N1 pandemic, and we learned that we were kind of tripping over each other as health systems and as health departments. And so could we do this better this time? Especially now with the vaccine being here, and it certainly is exciting that the vaccine is here. There's that light at the end of the tunnel. But we want to make sure that we're doing it correctly, that we have solid communication coming from all of us as health organizations or health departments, so that we don't confuse the population. And then there's a lot of logistical things, right? Dr. London talked about the storage and the deep freeze that you need for these vaccines. Well, we have to kind of work on what does that mean? When can we give the vaccine? How long does the patient have to wait till after they get the vaccine, like waiting either in the parking lot or in our offices to make sure they don't have a reaction? All those little details we are coming together and working on, again, as a community of healthcare leaders. And that's what's really exciting. And I do think it's unique to West Michigan that we have this. So I can't thank enough the Kent County, Ottawa County health departments, as well as my fellow organizations, Metro Health and Mercy Health.
So Keith, maybe touch on a little bit of these vaccines. These are mRNA vaccines, right? For the layman though, like give us the break, like what does that mean? How does it work? And then what's the expectation for how long it might be effective?
Yeah, good question. So I'm gonna give you everything that I know at this point. And as you know, it's a very fluid thing. But in general, the point of a vaccine basically is to create an immune response. So when you get your typical flu vaccine, right? You get that vaccine, and what we do is we look at kind of the latest strands of what we think is going to hit us in this coming year, and then we give that potentially that vaccine to create an immune response so that we create antibodies to prevent future infection. This is slightly different in that this is a naive disease to us. And so what I think you're going to expect is maybe a little bit more severe reaction to the vaccine. So we're talking about having kind of a fever, maybe some muscle aches, that sort of thing, because it's really mimicking what that disease might look like in your body. But that means it's working, right? That means that your body's creating that immune response, fighting that infection, so that the next time that you come into contact with that potential virus, your body can handle it essentially. And that's maybe the difference between this vaccine and then like the flu vaccine. What we don't know right now is this virus going to kind of morph? Is it going to kind of adapt and learn like some viruses do, like the flu vaccine, other viruses do as well, where we have to actually give like annual vaccines? We don't yet know that. And those are things that are still kind of up in the air. You hear certain things, certain studies that come out, but I can't definitively say that yet. But that's kind of the general idea behind vaccines. The other thing I'll say is this. I know there's a lot of controversy about vaccines kind of in the media, and you read things on social Facebook posts, but again, statistically, the medical literature continues to show over and over again that vaccines certainly are safe. And you could argue that vaccines are probably one of the greatest, if not the greatest, medical marvel that we've ever had, because we've been able to eradicate and eliminate disease that used to just ravage us in our history here. So that's what is exciting about. Again, I love how Dr. Adam London talked about going on offense, and that really is what this is about.
So, Dr. London, speaking of going on offense, Keith raised the point of, there's some controversy out there around vaccines, or differing opinions or perspectives, concerns maybe over safety or reactions. How do you plan to combat misinformation on the vaccine?
It's a great question, and it's really going to require all hands on deck. And we need to make sure that we have spokespeople from across the spectrum of life in West Michigan and elsewhere repeating this message that vaccines are much safer than the alternative, which is allowing this illness to go unchecked. And vaccines have an extraordinary safety record. They really do. And while it is true that when you deliver a vaccine or any product to billions upon billions of people, there may be some injuries. The same is true of any product. But again, to be very clear, I guarantee there will be far, far fewer people harmed by this vaccine than would be killed or permanently damaged by letting the virus go unchecked.
Yeah, well, I think that's important for employers, right? Communicating with employees, but also individuals. Communicate with those in your sphere. If you have access to this kind of information, please encourage folks to get that. Getting more questions in the chat. I definitely appreciate that. You mentioned it's going to be months before the general population gets it. We've been hearing, you need to make a plan, right? The governor mentioned that in her press conference yesterday, or Dr. Khaldun did. How does somebody go about making a plan, Dr. London?
Well, I think the first thing is just situational awareness and staying tuned to what we're saying and what Keith and our colleagues at our local hospitals and elsewhere, what your physician is saying about the availability. We are going to make no secrets about its availability. We desperately want the people of West Michigan to know when and where and all the other details about how they can get this vaccine. We want to make it as easy as possible. We recognize that we have a Herculean lift in front of us to try to get to herd immunity through vaccine as quickly as possible so we can stop the spread of the virus, but also all of the other economic and academic and other consequences that are resulting from the current status. So please stay tuned to us, and I thank you and the Chamber for making information available. We will be communicating loudly over the next few months about this.
Keith, question about the two doses. If the vaccine requires two doses a few weeks apart, is there protection provided between the initial dose and the second dose to the patient?
Yeah, and remember I talked about the fact that you get this kind of immune response, and that's your body's way of creating a reaction to that initiation of that dose of the vaccine. But it does require two doses, and some vaccines do that, and it's all about that immune response. So, as the Advisory Council on Immunization Practice and the CDC have learned, and they've done studies, what they've learned is it does require these two doses, and that they feel like once they give the two doses, it creates that substantial immune reaction that can have everlasting effects. And that's really the reason behind the two doses. It's not uncommon that we have two doses in a vaccine, but it's something that's unique, obviously, to this one.
Dr. Lunda, if you have had COVID, should you still plan to get the vaccine?
Yeah, so we're going to wait to hear what the FDA reports, but I expect the answer is going to be yes on that, because the vast majority of people who had it, they don't know that they had it for sure, and we don't know exactly how significant of an immune response having it may have created. So to be safe, I think the answer is going to be yes, but that's one of the questions we're still waiting for final clarity from FDA and CDC.
Keith, and maybe Dr. London, you can pile on this. Do we have in West Michigan and Kent County the equipment needed, the freezers to store these first vaccines that I think were referred to as high maintenance?
Yeah, high maintenance. That's good. We do actually. So again, through our West Michigan COVID-19 vaccine collaborative, we've talked a lot about what the equipment and the staffing it's going to require to have this vaccine. I can just speak, directly to Spectrum Health then and say, we've been talking about this since the early summer, where we felt like we started hearing rumblings about studies about a vaccine, and then we really started preparing. I know my colleagues at Metro and Mercy and the health departments have done the same thing. So we really, have been on it from day one, getting prepared for this day when these vaccines finally show up and we can hopefully, eradicate this disease.
Yeah, and we do as well. We have the freezer unit, and we have more on the way. The challenge is going to be that most of the places where people get vaccine on an ongoing basis, their doctor's office, the corner pharmacy, those places aren't going to have that sort of equipment on hand. So we know that availability is going to be somewhat limited early on to the few places that do. But again, hopefully we have other vaccine products available before long that aren't so high maintenance.
Yeah, so some of those different vaccines we could see be distributed at employers or more places that don't require some of the other facilities. Dr. London, you mentioned kind of the impact the restrictions to slow the spread are having, business, education, mental health, other places. When you think about it from a public health perspective, how much of the population needs the vaccine or some kind of vaccine to start lifting maybe mask requirements or social distancing requirements? I know we're probably getting really far ahead of ourselves here, but I know it's a question I've gotten from members.
Well, I really think for at least those simple things like masking and social distancing, I think we should be thinking about that herd immunity level of 65 to 70% of the population. Now, I think we can get there pretty quickly, assuming that we have supply of vaccine available and assuming that we have a population that's willing to be vaccinated. Most of our surveying say that both of those things are reasonable. I think that many of the aspirational goals are by next summer, we can start getting close to that number. And certainly as we go into next fall, school and sports and things like that, I hope and I believe we'll be able to proceed without the sort of complications we've had this year.
Would you foresee, another question in the chat, possible requirements for employers to have a certain amount of number of employees vaccinated before being fully open?
I don't know. I don't expect that we're going to see many requirements for individual entities like that. I think that gets awful difficult to monitor. And I know that the requirement for anyone to get vaccinated, we don't expect that to be the case, especially while this is approved under an emergency use authorization. I know we're not going to require our staff to be vaccinated. We're going to offer it and encourage our staff to become vaccinated, but we're not going to require individuals to do that. So I think we really want to focus on the community level goal of getting our population overall to that 65 or 70% number.
Yeah, I couldn't agree more with what Dr. London said. It's the same here at Spectrum. It's really about spreading that factual information that how beneficial this vaccine is, and if it's so beneficial, then requiring it or not really isn't necessary anymore, because hopefully people understand how important it is to get the vaccine. So couldn't agree more.
Yeah, and we'll touch on some of those legal issues with Sarah Willey here in a minute. Keith, I already got some questions from members saying, I'm an adult foster care facility. Does that qualify in the first round? Or, you guys talked about the broad swaths of who's going to get it first. But if I'm an employer that maybe has a detailed question, where am I going to find that information? Is it going to be from the CDC? Is the state going to make that, or maybe the county health departments?
Yeah, good question. So I think it's going to be from a myriad of things. What we've talked about in our West Michigan Collaborative is maybe coming up with like a website that we could have as all people kind of going to as kind of one source of truth. The thing we have to kind of think about, though, is if the CDC is coming out with certain recommendations or ACIP, are we going to be confusing people by creating a whole separate website? And so those are things that we're kind of thinking about right now through the West Michigan COVID-19 Vaccine Collaborative. Is what is the best way to communicate to all? So again, that we're creating a very clear message. What I will say is this, in terms of communication, I think what you're going to see is over the next couple weeks, a lot of standardized communication coming out from, of course, Dr. Adam London and Kent County, and then we'll be kind of right there supporting. We want to make sure that our communication touch points are all very consistent. So again, people understand exactly what they're supposed to do and when they're supposed to do it.
I think the county's done a great job with the county website of getting information out throughout this with the dashboard. So I think you point out a great spot for that. The questions are flying, Dr. London. One that's been repeated a couple times is cost. What are we hearing about, who's going to pay for these vaccines?
So the vaccine's being made available to all of us at no cost by the federal government. And so there may, depending on the provider, there may be an administration cost that's charged. I would expect that would be picked up by Medicaid or by insurance if that were available. I know at the health department, we're not going to charge people outside of what might be covered by Medicaid or insurance. So we do not want cost to be an issue for anyone. So I don't expect there's going to be much out of pocket for anyone, if anything.
Gotcha. Maybe kind of a specific question, maybe along those lines again. If you're a designated phase 1B critical infrastructure employer, where do you get more information to begin understanding how to roll this out to employees?
Yeah, so we are working, as Keith mentioned, through the Vaccine Collaborative and through the Regional 6 Healthcare Coalition to make sure that information is known to all of those first response organizations. And we're going to be very aggressive as vaccine becomes available and make sure that they have time and date established so that they can make sure that they can get their staff vaccinated as quickly as possible. We really want to get those first responders vaccinated as quickly as possible.
Yeah, and if I could just add on to that, Dr. London, well said. I think the thing I want to preach here is patience, and I know that's hard, right? Because we have this vaccine. Everybody's certainly excited about it, and we are excited about it. At the same time, though, things are coming at us very, very quickly over the next couple weeks. And so as we learn information, certainly we're going to start that kind of, media blitz of communications to all of you. But really, it still comes down to having patience and trusting us that we're going to get the information to you at the right time, at the right place. And then really, as Dr. London said, it's all the same things that we've been talking about since early March, right? It's the masking, it's the social distancing, making those circles smaller. It's washing of the hands. We still have to continue those things. So my emphasis to all of you is to not let those things go because the vaccine is here. We still have to kind of be, really be due diligent now more than ever, because it's almost here. So let's keep those things up.
And that's what I hear as the takeaway for communication from employers to team members is you need to practice patience, but make a plan, be thinking about it. We're going to stay tuned to information as it comes out. Just a couple more questions before we transition to some of the legal implications here. Dr. London, I got one question. Why is the UK ahead of the US on this? And also, why are they starting with elderly and nursing home while we're starting with health professionals?
It's a good question. It's that double-edged sword of safety, and that the U.S. really has the world's highest standards for pharmaceutical safety. And the UK has a lower standard for the data that they receive and review. They accept the pharmaceutical company's data without much outside review of that. So we have the highest standards anywhere. We really do. China and Russia have been vaccinating for months now. The UK for a couple of weeks now. Most of the rest of the world simply says that when the U.S. Approves it, then it's good for us too. And so that's what we get for making sure that we have that safety practice in place. The challenge, however, is that we lose some time, but it's time well spent.
Keith, we got a couple questions. For pregnant women or breastfeeding women, should they just sit tight, be patient, wait till it's studied a little bit more? Is that the answer there?
Yeah, again, I think as more information comes about, I think we'll kind of have those recommendations kind of come out. I do want to touch on something, a quick thing for your previous question in regards to the long-term care versus the medical infrastructure, right? If you think about what happened in China in the early days, their medical infrastructure really started to collapse. Why is that important? It's important because just because we have COVID, it doesn't mean that every other disease stops, right? We still have other diseases that we are still fighting and other hospitalizations that we still have to take care of. So I think our stance is keeping that medical infrastructure up and going so that we can support the community as a whole still is probably the best answer, the best way to go about it versus those long-term care facilities first. Again, you could probably argue, either way. I think though that we've just kind of taken learnings from other countries that you really got to keep that medical infrastructure going first and foremost.
Speaking of which, question in the chat, and I swear I'll wrap up with just a couple more here. Any general update on where we stand with healthcare capacity, inpatient volumes?
Yeah, from Spectrum specifically, you're saying?
Yeah.
So let me just talk, kind of high level. First of all, our positivity rates, have trended certainly upwards. I think we have a little bit of a stabilization here as of late. We are kind of at that red capacity, which is at the highest capacity. So certainly our ICUs and our medical floors are full. But what I say is, I think we, as Adam talked about in the beginning, we certainly learned a lot in the spring, and we geared up in the spring for this mass surge. And because we kind of geared up in the spring, we certainly are handling it very well. And that's encouraging, right? So even though we're very, very full, we certainly have more capacity to take on more if needed with some, kind of reserve plans, if you will. But it's also tiring. I'm not, I give credit to all the frontline workers out there. I know how exhausted they are. And I hope that everybody understands kind of what they're going through day in and day out, taking care of these patients. But again, because of all the hard work of our medical infrastructure, our healthcare workers, our leaders, we've been able to handle it. We are full, but we have, plans if we need to expand more.
Dr. London, just building off that, any reaction to the governor's 12-day pause or 12 more days of pause that she instituted yesterday?
Well, I think, I think it's unfortunate. I think it may have been necessary, but I think it's unfortunate because I really believe in what we've seen so far with this virus, that we could have kept many of those businesses open if we had universal comprehensive practice of facial masking, distancing, hygiene, all of their precautions in place. We have seen that be effective in other places around the world. It's just unfortunate that it has become so political of an issue that we've got people still fighting over whether or not masks are useful or not. And as a result, the consequence has been that we continue to see these numbers be very difficult for public health, for our hospitals, and for our community. And so it's unfortunate, that we don't have resources in place to support those businesses more thoroughly. If this is the cost that it's going to take in order to stop the spread of this virus and protect our community, then as a community, we ought to have found resources and programs that could more sustainably provide for those organizations while they are suffering and while they are paused.
Oh, thank you. Thank you for those comments, Dr. London. It is a very tough time. And thank you both for your time today, for your expertise, Dr. London and Keith, and walking our attendees through, what this distribution is going to look like, the practicing of patients. I know Spectrum Health, all the health systems, your collaborative, the health department, the Grand Rapids Chamber, we're going to be doing our best to get all the information out as we can, as soon as possible. So thank you so much for your time today. Would like to turn it over to Sarah Willey with Miller Johnson. She has experience in labor and employment law matters for clients ranging from small family-owned businesses to large multinational companies. And we had some questions in the chat about exemptions, and I would love for Sarah to talk a little bit about the legalities that employers need to be thinking about as vaccines start to roll out here as soon as possible, as soon as safely possible. Sarah, take it away.
Thanks, Andy. I appreciate that. And thank you again to both Keith and Dr. London. I am certainly in line with all of the attendees and soaking up all of the great information they're giving us. So thank you for that. I appreciate it. And certainly recognize that we don't have all of the information or answers now. And I know that many people wish we did, but we don't, and we're going to be learning about more information about the vaccine every day. So I know I'm just really encouraged to hear specifically about that West Michigan COVID vaccine collaborative, because that sounds like that's something we're really lucky to have here in West Michigan. Okay, so turning to my side of things, I want to talk first a bit about whether the vaccine can be mandated. And I want to talk about that because that is by far the #1 question that I see clients having. And as I do that, I also want to talk about what I think you as employers should have in your plan now, okay? Many of you will not be talking significantly to your workforce about getting the vaccine probably for several months. Some of you will be now. You might work for a hospital or a nursing home, in which case this question is more immediate. But many other of you are gathering information at this point and planning. Okay, so I'll be talking about that as I go. The first thing that I want to make really clear to everyone is that this vaccine is government allocated, meaning you as local businesses and employers really don't have control over when you can get it in your hands or when your employees can receive it. So I saw a question about, is there any way we can get it, right? Can we pay extra money to get the vaccine? The answer is absolutely not. The CDC and the Michigan Department of Health and our local health departments are all working collaboratively to make those decisions, and it's going to be a phased approach, as you heard both Keith and Dr. London say. So when we think about vaccine mandation, we can turn to, from a legal standpoint, what we know with regard to other vaccines like the flu shots. But really, we also have to keep in mind that the situation right now, of course, is unprecedented, right? We are talking about vaccines in the midst of a devastating global pandemic. That's nothing like getting the flu shot every year. We are also talking about a vaccine that's received this emergency use authorization, which is a bit different than the way we normally see the FDA approve vaccines. Now, let me be very clear. But Keith and Dr. London emphasized that the FDA review is exhaustive. And if the FDA says this vaccine is safe and effective, there's no reason for us to question that. But it does add a layer of uncertainty, perhaps, among your workforce. And also, interestingly, you should know that the federal regulations that apply to emergency use authorization does require that any recipient be informed that they've got the option to accept or refuse the vaccine. In other words, you may have employees that get that information sheet when they get vaccinated, and it's going to say on there that they've got the right to accept or refuse it. You also need to understand that the vaccine has limited availability. So many businesses, even if they wanted to mandate their entire workforce get the vaccine tomorrow or next week or even next month, may not have that option, okay? So what that means to me is for many of you who are listening today, you are developing a plan. You are in the starting phase of developing a plan. But really, when you're going to be making the decision about whether or not to mandate the vaccine for your workforce, you're probably going to have much, much more information than you have today. So be willing to be nimble with your plan. You may decide today that you are not going to mandate the vaccine, but in March you may change your mind. You may decide today that you are going to, and again in March you may change your mind. So please be open-minded to gathering information. Okay, so what do we know today about whether we can mandate the vaccine? Well, there's a handful of considerations that I want to point out to you. The first is the Americans with Disabilities Act in Title VII does allow for certain exemptions for employees. And I'm going to be talking about those in more detail in a minute. But before I get to that, also know that there is some OSHA guidance on the question. The only thing we have is a 2009 letter from OSHA that applied, of course, to the flu vaccine, not to this vaccine. And what OSHA said at that time is that employers could mandate the flu vaccine, but are not required to do so. Whether OSHA is going to have the same position for the COVID vaccine, we don't know yet. That's one of the things we're going to be watching for. If you are a business with collective bargaining agreements, remember that vaccine mandation is very likely a mandatory subject of bargaining, and at the very least requires notice to the union. So don't forget that aspect of things as you're working through this. Two other considerations to bear in mind is the National Labor Relations Act. That's a federal law, protects employees who engage in protected and concerted activity. I am anticipating some workforces might have a significant number of people objecting to the vaccine. And if so, be careful, because that could get into the area of protected and concerted activity under the National Labor Relations Act. That would be a situation in which I just want that to raise a red flag in your brains and maybe consult with your legal counsel if you have that going on. And then the last item to think about are state privacy laws. Some states have unique laws that say that employees enjoy fundamental privacies. Michigan is not one of them, but other states have them. And some of those states would prohibit employers from requiring their workforces to get a vaccine. Okay, so with that backdrop, I do want to focus for a few minutes specifically on the ADA in Title VII and what they have to say about the COVID vaccine. The first consideration under the ADA is that, of course, employers can't require employees to get medical examinations whenever they want for no good reason. And so employers need to think through whether the COVID vaccine would be a medical exam. Based on EEOC guidance to date, the answer to that question would be yes, which then means we need to be in a position to demonstrate that the vaccine is both job-related and consistent with medical necessity. I truly believe that is not going to be a significant issue for any of you. Based on the guidance the EEOC has issued to date regarding COVID testing and health assessments, et cetera, I believe they are going to defer to both the CDC and the FDA with regard to whether individuals should get the vaccine, which is my long way of saying if this vaccine gets approval from the FDA, I don't think it's going to be a problem to require employees to get it under the ADA, even though it's a medical exam. However, remember that employees also under the ADA can request a reasonable accommodation if they have an ADA-covered disability. And we have experience with this based on the flu vaccine. Many employers, particularly healthcare providers, have historically mandated flu vaccines. And every season, they typically have a certain number of employees who request an exemption from that because they have an underlying disability for which they can't take a vaccine. They might be undergoing cancer treatment or chemotherapy. They might have some sort of allergy, et cetera. So understand that employees would still have that ability under the ADA to request an accommodation that would include not having to get the vaccine, even if you mandate it. Now, as part of that ADA accommodation process, we would look to alternatives in the workplace, right? So if an employee can't get the COVID vaccine, what can we do otherwise so that they could continue working? And likely we would be turning to the things they're doing right now, wearing masks, keeping up those plexiglass barriers, having protective gear, et cetera. Excluding them from the workplace altogether is a last resort. Okay. Now, the ADA reasonable accommodation process certainly gives businesses the ability to request medical information to substantiate the need for a disability. So you'll want to have, if you're considering mandating the vaccine, you'll want to be ready with some sort of accommodation process in place as you roll that out so that you're ready to go. Also, Title VII has an obligation to accommodate religious beliefs. So employees can also be exempt from getting a vaccine based on what the law calls sincerely held religious beliefs. And we've got to accommodate those beliefs unless it would be an undue hardship on our business to do so. Under Title VII, undue hardship is a much lower standard than the ADA. It's just a de minimis cost, okay? When we look at religious accommodations, we typically are turning to that undue hardship analysis because it is not particularly difficult for employees to demonstrate that they have a religious belief or that it's sincerely held. Under Title VII, a religion is not what you would normally imagine it to be. You don't have to attend church. It doesn't have to have a formal name. It's really just moral or ethical beliefs that involve right or wrong, and so long as the employee says that they sincerely hold them, then they can seek an exemption. So generally, religious beliefs have to include what the law calls ultimate ideas, or things about life, purpose, and death, right? Brings me back to my college philosophy classes. It is, however, more than medical beliefs or political philosophies, right? So if you have an employee just saying, I don't believe I believe vaccines cause autism or cause harm, or I think for political reasons I shouldn't take this vaccine, that would not be enough. Examples of statements that employees have made in real cases for which courts have approved religious exemptions are, our bodies are a temple and God gave us dominion over our bodies. Injecting the flu vaccine into my body is morally wrong. Or followers of my religion are healed by plants, fruits, and grains. So you guys get the idea. Quite frankly, what this means for all of you is that your clever employees will be able to go online and probably figure out what they need to say in order to get and request, I should say, in order to request an exemption based on religious grounds. So be prepared for that. And again, I would recommend you have thought through what sort of process, written process you want in place, who is going to evaluate those requests, and how you're going to be making those decisions. Also think about what it means then if an employee gets an exemption based on religion. How are you otherwise going to accommodate their belief so that perhaps they can remain at work, and or will you be giving them a leave of absence if not? On the Title VII side, you can request documentation. Because it's not based on a medical need, that process, quite frankly, carries less meaning, because really an employee can just express what their religion is and say it's sincerely held, and that would be enough. On the piece about paying for the vaccine, that was answered in a question, but just to reemphasize that, it will be, the bottom line is, it will be available from the government at no cost to everyone. And also the CARES Act does require health plans to cover it, okay? So if you have an employee that's covered by a health plan, all costs should be covered by the health plan. If they're not covered by a health plan, guess what? It's going to be free anyway, because our federal government is going to pay the tab for it. Just another minute on what I think you all should be thinking about now. Top of my list, quite frankly, is what sort of educational piece are you going to provide to your workforce about the vaccine? And I've spoken to a number of businesses about this over the last several days. And I will tell you, many of them are looking towards some sort of short video, 5 or 10 minutes, to give to all employees. That is an idea at this point, and actually I was going to throw that out there on this call intentionally, because I think there could be some collaboration between our local health departments, maybe Spectrum Health, maybe the chamber, et cetera, to come up with something like that for businesses. And other employers are looking toward having some sort of health professional come in and meet with their employees as well. The idea being, to the extent we can get the education, the information to our employees from an individual with science knowledge, and not just an HR, not an HR person or a lawyer, the better. You all should be thinking about a written COVID-19 vaccine policy, including whether you're going to mandate it. You're going to want to have that accommodation process in place. And I would say now start thinking about your plan to know how to get information from your local health departments, because they are likely going to be the ones that are going to be providing information about when your workforce can receive the vaccine and how that's going to happen. We know today now there's this West Michigan collaboration, so we can be on the lookout for more information from them.
No, great information, Sarah. And I think getting example plans out to members is something the chamber will want to work with legal experts like you with, to at least get maybe templates out, or maybe we can ask the state to also think about that. A couple questions just before we wrap up. I know we're going a little long, but a lot of good questions. One is, how should employers think about collecting health data about who is vaccinated, who isn't? How do employees how's that going to work, right? How do employees prove that they've been vaccinated? Seems fraught with tension and division in the workplace potentially.
Right. And that's a great question. So I'll answer how are we going to know first, and then maybe I'll answer how are we going to keep it. So it's my understanding that people are going, when somebody receives the vaccine, they are going to be given some sort of card, actually, that's going to say they received the first dose, and then they'll bring that card back and it'll show they received the second dose. My assumption then is it would be quite easy for employees to bring in that card and provide it to the employer, or provide a copy to the employer so that they have that information. Once that's in our hands, of course, that is what we would typically know is medical information regarding an employee, and that should be kept in their confidential health file.
And then final question, would employers be financially responsible for covering medical costs incurred to treat side effects or disabilities from the vaccine if they're mandated to receive it?
That is a good question. If they are mandated, I suppose that there could be an argument that would fall under the workers' comp coverage, right? That was an injury incurred in the workplace because you required an employee to receive the vaccine as part of their employment. But that would be covered by the workers' comp bar. I don't foresee any sort of negligence claim related to that. I would also add that, of course, if that employee has health coverage, their health coverage would cover medical treatment for side effects, et cetera.
Well, Sarah, thank you so much. We really appreciate your expertise and engagement today, and just greatly appreciate it. Thank you. And thank you all for joining the discussion today. Thank you for indulging us as we went a couple minutes long. Truly appreciate our speakers sharing their expertise with us. As you can tell, a lot of questions, a lot of information, a lot of resources. We're as the chamber going to need to continue to get to you, our West Michigan business community, as this goes forward. So I can imagine we'll be having other town halls like this on vaccines as we learn more and as new information comes out. Our Chamber Government Affairs team is going to be keeping you up to date on the latest. If you have questions in the meantime, please reach out to us at grandrapids.org. Email me at andy@grandrapids.org. We work for you, our West Michigan business community. We want to help you get through this any way we can. Please mark your calendars for the Chamber's 133rd annual meeting on Tuesday, January 26th. There's hope on the horizon, and we have a speaker coming to talk about innovation and entrepreneurship and opportunity that awaits us in West Michigan, Josh Linkner. So register today at grandrapids.org. Thank you so much. Make it a great Tuesday.